This is White Coat Day, so this is when emergency physicians come together and we get a chance to talk about the issues. We walk around, we meet with legislators and their aides, and really just let them hear from us how these issues impact us, and hopefully bring up some things that they may not have thought about or provide a perspective that they haven't considered. Are you going to kind of herd the cats around the building today? Okay. HB 793 would grant nurse practitioners independent practice in Virginia. Virginia ASAP opposes this. We believe that the level of training and experience necessary to practice independently is a fairly high bar, and that bar has been set and met for decades, hundreds of years, and we believe that that bar should be set for anyone that wants to practice independently. The nurse practitioners will argue that nurse practitioner training is equivalent to medical training, and that with 1,000 hours of clinical practice, which is about 6 months, that they are able to practice independently. We disagree with that because, as any physician knows, going through residency training is really where you learn how to practice independently. That's an organized program. It has standards. It has bars that must be set throughout the program, continuous feedback. We believe the current model of a collaborative approach is the best model. We have nurse practitioners that have tremendous skill sets. They have the ability to perform many of the functions that a physician provides. Working in conjunction with a physician helps expand the care that can be provided to patients. It's a model that works. It works very well in many emergency rooms across the state, and we would like to see that model continue. So regarding balanced billing, there's 2 bills before the legislature this year. SJ 57, sponsored by Senator Sturtevant, and then HB 1584, sponsored by Delegate Byron, deal with balanced billing. Sturtevant's bill is asking the Joint Legislative Audit Review Committee to fund a study looking at the impact of balanced billing. Virginia ASAP is prioritizing doing that very thing this year. We want to build a collaborative approach to studying and implementing a plan to solve balanced billing, work with the health plans on that. So we believe that we have an approach that will address that bill, and Delegate Sturtevant will hopefully carry that bill over to next year to allow us to work on it this year. HB 1584, Delegate Byron's bill, deals directly with balanced billing and attempts to ban the practice of balanced billing specifically for ancillary services. The definition of ancillary services right now is very broad in the bill. Really, her intention is to create some sort of notification to the patients so that patients are aware that they may be receiving services from an out-of-network provider. We actually support notification. We think that patients should know that they might be receiving services from an out-of-network provider. However, again, we have a comprehensive plan in place to address this in a way that protects patients, protects physicians, and protects the health plans that we want to work on over the next year. So we are respectfully asking Delegate Byron to carry this bill over or amend it to simply request notification. SB 505 is a Doctor of Medical Science. This bill would attempt to create an alternative pathway to independent practice for physician assistants that would be equivalent to a Doctor of Medicine program. We oppose this. At some point in the future, with more vetting, this might be an option, but right now this bill is not ready for prime time. The other bill that we are working on today is HB 886 by Delegate Stolle, and this would really just streamline the process by which state physicians and emergency physicians can communicate with mental health facilities about toxicology results. Also, while not addressing a direct bill today, the topic of Medicaid expansion is big in the legislature this year. Virginia College of Emergency Physicians supports increased coverage for members of the state of Virginia. We recognize that straightforward Medicaid expansion can sometimes be complicated, but there is a lot of waste in the system of Medicaid, and so while we do support increased coverage for everyone, we want to make sure reforms happen that help control costs and help recipients utilize the proper services at the proper time. To hear from us brings it down to the personal level. A lot of bills, a lot of issues look great on paper, but when, like anything in life, when you sit and you talk to a person one-on-one, you hear their story, you see how it impacts them, and something might look great on paper, but might not be great for people. And this brings the people into it so that they can see how these bills impact us, for better or for worse.